Welcome, Steph Neville and Ashley Bond here once again. Hot topic time. This episode, we're going to talk about dental billing fraud, the big F word.
Dum dum dum.
Um, right? A lot of people just don't understand what it is. Many people don't realize that they're actually committing this and what the ramifications could be to that action. So we really want to have just an open conversation about that to hopefully help some people maybe stop doing things they shouldn't be or prevent people from doing those things. So, that being said, I'm going to hand it over to Ashley to get us started.
Yes, fraud, 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 which is a big buzzword in the dental space with dental insurance. So, a lot of what we are going to talk about today is it's inadvertent fraud that we see that's happening. That's not always on purpose, but it's what we see a lot as a billing company. And hopefully, what we can share can help prevent your office from ever having to deal with an audit, sending money back to the insurance company, or potentially something worse than that. What I would love to kind of start off us with is about the claim form and the number one thing that we see on our side with offices, and then how we advise them if we do notice this. So, for that claim form, it is a legal document that you are submitting to the insurance company. So, that has a signature on it. When you submit that, that is a legal document. Again, you're sending them. So you have to make sure everything on that legal document is accurate. So I'm going to break down a few things that we see on that sometimes is inaccurate. Why is that inaccurate sometimes, and how can you prevent that? Number one that we see often is that treating provider versus rendering provider. Sometimes with practices that have multiple doctors, they will have the treating provider listed incorrectly. The reason is a new doctor or doctors might have come on and they're not credentialed yet. And in the meantime, they will use the billing provider's details under the treating provider instead of the actual dentist that saw them. It has actually come to my attention that part of selling practices, sometimes it's actually in the contract that says you're allowed to use my credentials to submit claims for the next 3 months, 6 months. So dentists are coming into new practices, or providers are coming in thinking because they signed that, then this must be legal. And we're just here to tell you that if you're putting the wrong provider under the treating provider, that is not something that you want to do. The treating provider has to be the dentist that saw the patient. It cannot be changed for credentialing reasons. It cannot be changed because maybe you are on a better fee schedule with a different provider. It does not matter. That has to be the doctor that saw the patient. Even if you have a new dentist coming in and you need to be credentialed, it doesn't mean you can't send the claim. Yes, they might process it out of network. That's okay. That is the right way to do it. You can also start your credentialing process sometimes earlier so that by the time the new doctor comes in, or if it's an acquisition, that you're already credentialed. That's what my father's practice did. His practice was bought by another doctor who started the Delta credentialing before that transfership happened. So by the time he started, he was already credentialed. He didn't have to worry about being out of network for a little bit. If you don't have the time to do that, though, the best route is to put in the correct treating provider, and it might just pay out of network in the meantime until you're credentialed. And we just had Shelly on the podcast to talk about credentialing and how that looks, how you should do it the correct way. If you guys don't have someone on your side, an expert helping you with that, we highly recommend PPO advisors to help you with your credentialing services.
Absolutely. And just to back up a little bit to contracts, selling a practice, things like that. And we're not saying we know more than a lawyer who wrote a contract. What we're saying is, from an insurance company's perspective, they don't care what was in your purchase agreement with changing hands from provider to provider. And I know locum tenens is a big buzzword right now. Even the ADA claim form has a spot for it. Here's the thing though, If you don't have an expert help you, you likely are not going to do it the right way. And one of two things is going to happen. You're going to misbill and inadvertently commit fraud, or nothing's going to get paid. So when it comes to a temporary provider, so to speak, say a doctor's sick, you have a temp doc come in. Of course, your instinct's going to be to just bill it like the doctor was in the office, but then your clinical notes don't match, different initials. Understand the locum tenens in your area and per plan in that situation. If you're in the midst of a sale and it's written in the contract, like Ashley mentioned, get a credentialing specialist to look all of that over with you and understand who needs a W-9 and where does it need to go? What does that mean for me? What's the time frame? Just check off all of your boxes. And when in doubt, bill 100% the way that the patient was seen and who they were seen by, where they were seen on your claim form.
Yeah, and a lot of times with that too. So if you want to file the locum tenens, you have to do that in advance. That's not something that you can typically just submit after the fact. You have to coordinate that with the insurance company. So fill out forms with them before you start seeing patients, saying that, if a doctor's coming, say for a maternity leave, that can't be done the day they leave. You had to pre-set that up for the provider that's going to be taking over during that time period with each individual insurance company. So again, if you're coming across those, get an expert in the space, and just know if you have anybody telling you it's okay to change your treating provider, get a second opinion. With our clients, we want to protect the office, we want to protect the doctors, and so we will never recommend changing the treating provider from who was actually seen or who actually saw the patient. Same with data service. Sometimes we get this, or I've gotten this question before in the past of, can we change the data service to, get this claim in after the new year or before the end of the year? And it's no, you can't. You can't change data services. You have to do it by the book. It's not worth risking the practice, risking an audit, risking a license. Worst case, people have gone to jail for certain fraud activities. Now it's typically, it's not going to be the inadvertent mistakes that happen. It's going to be the purposeful, fraudulent, collecting money from work they didn't do type of situations. But everybody is liable who is handling the claims. So just be proactive. Make sure you know all the rules and regulations of what you can and can't do, and just don't take one person's word from it. Seek out expert advice from multiple sources.
Exactly. And back to Shelley, something she told us while we were getting ready for the last podcast was that insurance company reps are even at times using Google to see if your clinical notes and the way you're billing are lining up. They're doing Google searches and comparing how many providers are in the practice on the website versus how many they're seeing come through on the claim forms. So it's a big deal. Um, so make sure, you just have all your ducks in a row there.
Yeah, that was shocking. That was shocking to
I
me.
know that
That
blew my mind, honestly.
I mean, it's pretty smart though. I mean, you can
Yeah.
Google and see how many doctors are working in your practice. If you're submitting under one doctor, it's gonna get caught on, and you're gonna get
Mhm.
audited, and you might have to pay back a whole lot of money. It's just not worth it. It is better to just equip your team with the verbiage on being out of network. In the long run, it's going to be better for you, the patients, the practice. Just get comfortable with those conversations that you should have with the patient if it does have to be processed out of network. Which
Mhm.
brings me to my second inadvertent fraud, and that's with discounts. So a lot of offices, if they go out of network with a company, sometimes they'll want to honor the in-network fee for a short period of time. And discounts is something that happens often in the dental office, whether it's family friend discount, employee discount, in network discount. So, Steph, what do you got to share about the discounts?
Well, as far as discounts go, I mean, I think it's another innocent enough type of thing. You have a patient that comes in and they're upset you're not in network anymore, whatever the case may be. So you say, hey, we'll just honor what that allowed amount would have been regardless. But you're sending your office fees to the insurance company. So that's misbilling. And this is what is missing for a lot of people. Whatever you send to the insurance company, whether in or out of network, and forget even who's in network with who or not within the office, you're sending one fee to the insurance company, which we all recommend billing your office fees, but you're basing your patient portion on a lower fee, the percentage. That's where the trick comes in. The insurance company has to know the true highest dollar amount that the patient would have been paid and the percentage of that they paid. So it's okay to honor the discount of a PPO plan with an out of network patient, but you have to send the PPO fee to the insurance company in that situation and not your UCR. That's probably the only time you're going to hear us say, don't send usual and customary or
Right.
office fees. Both we all use those interchangeably, so forgive me there, but that's where the tricky adjustments come in.
Yeah, and you had to be careful because if you have your, if you're sending claims and it's set up in your practice management software that no matter what, your UCR fees go out, if you are honoring your in-network fees, you're going to have to pay very close attention. Make sure you're stopping those, correcting the fees that are going out are your in-network fees. So yes, you can give the discount. You just have to give the discount to the insurance company as well as the patient. So if your UCR fee is 100, your in-network fee was 80, that claim needs to go out with $80, not the 100 and then you write off the 20 after it's back. You have to send the first time the discounted fees. Same for if you're giving an employee a break. You have to send the discounted fees that you plan on charging the patient. But this also can help with patient billing. So it is your duty and part of the contract that you collect from the patient in full their portion. So if you do ever get any resistance for patients paying their bill, that is part of the contract that you have. It's in your provider manual, it's in your contract that you have to attempt to collect that from the patient. Now, if it becomes uncollectible, you've tried, yes, there is a point you can write off and activate the patient. You don't have to keep that on your books forever, but you have to attempt full collections for the patient amount that's reflected on the EOB. And it's why, too, with our billing services, we adhere to the EOBs. We can't do any special adjustments outside the EOBs. We adhere to them because any other discounts needed to go out with the claim initially.
Exactly.
There's one other um, item too when it comes to fraud so we talked about treating provider, rendering provider, which is number one thing that we see often. So again, our advice, get credentialing help before either you're buying a practice, you're joining a practice, if you're bringing on an associate, if you're moving, like whatever situation is happening, talk to a credentialing provider months before that happens. If you don't have time, get the verbiage on how to talk about being out of network and just do it the right way from the start. Insurance companies are looking. If you ever get asked to be audited, don't freak out. Does not necessarily mean you did anything wrong, but you do want to go through with that audit, submit all the information that they're requesting. Data services, if we don't ever want to be changing those data services. Discounting treatment, if you're going to discount, that is okay, but it has to be on the claim form. And last advice that I would give would be to check your provider, your payer manuals. So the contract that you've signed with the insurance company, you should have a manual for your contract. Make sure that you know what it is. Read through it. They might publish a new one every year. Make sure you know what changes are coming so that you just aren't inadvertently doing things that you're not supposed to. So make sure you're checking those, downloading them to a shared folder. If you can't find them on the insurance portal website, call them at the start of the year, ask for one, and they should be able to provide that. And then you just want someone in your office that knows the ins and outs, especially if you're submitting claims on, what you can and can't do for that payer.
Yeah, exactly. And I just thought of another small one that miscoding, and I will use
Mm,
X-rays as an example. So, say you take a pano and bite wings on a patient, but to you that's a full mouth series. So you think, well, I'm going to bill out a full DO210, which is an FMX. That's a no-no. You have to bill out literally the treatment that was rendered. If you build a pano and 4 bite wings, you have to bill a pano and 4 bite wings and accept whatever the EOB comes back as. And again, going back to those adjustments and making sure that you don't um, create any issues with adjustments, you just have to properly document, make sure you're within the rights of the contracts and knowing those with whoever you're in network with and who you're billing through.
yes. It really is as simple as bill what you do. Whatever treatment
Yep.
you perform, bill it. Don't group it together, bundle it, and I'm going to send this code. Bill what you do. That,
Mm-hmm.
again, it's a legal document. You're putting the codes. If you don't understand the codes, get those CDT books every single year. Use it as a training manual on what do these codes mean, and don't try to change your codes to get better coverage. You just need
Right.
to bill what you do and be able to have strong conversations with patients how insurance isn't a guarantee of payment. Insurance is more like a coupon. Dental insurance is not like health insurance, but they need to know the benefit to the treatment, not make it dependent on what their insurance is or isn't going to cover. You're the healthcare provider. You're there to diagnose and recommend treatment that they need, not necessarily based off of what their insurance will or will not pay for.
Yeah, and like you said, an EOB, it's a legal document, or a claim form is a legal document. So when the EOB comes back, make sure an expert is posting it. I think many think it's like accounting. You just need to get the dollar amount that's on the EOB into the ledger. But it's far more complex than that. You need to understand, whomever is posting needs to understand why that dollar amount is on that EOB, why something did or didn't get paid, and understand the relationship between what was billed and what was paid to learn the nuances of dental billing. It isn't just it's not just accounting. So
Mm-mm.
again really important to have experts who are paying attention to those EOBs to understand the relationships with you and the insurance company the EOB is coming from, and what changes may come down the pipeline, which relates back to last week's episode with Shelley and umbrellas and networks and things like that. Those EOBs, when you're billing to insurance, are one of the cornerstones of your dental practice and your dental revenue cycle management. So if you don't have somebody who's posting that truly understands what EOBs mean, you just have to reach out and ask for help.
Yeah, absolutely. And especially if you're listening to this because, you have multiple doctors in the practice, I can't stress how important posting EOBs is, making sure your line item posting it's going to the right provider, the adjustments are going to the right provider. All of those little details that aren't necessarily just straightforward black and white have to be meticulously worked through to make sure that your providers are also getting paid correctly through posting. So that could be a whole other episode on posting.
It could, absolutely. And as far as this episode goes, we do have a blog post up. It's been there for just a minute now, but at withwisdom.com under resources, you can check that out. There is a post avoiding dental insurance fraud in there, and actually preceding Shelley even meeting with us here, one of her articles is linked up there. There's a great story in that blog about a doctor who inadvertently committed fraud. You may recognize his name once you pop in there and take a look, and actually ended up going to jail. And we're not trying to be scary here because a lot of small things can be fixed very easily. But what we are saying is it take it seriously. take it seriously.
Yeah, absolutely. And Roy Shelburne, he's done such great job in this space, just getting his message out there, and so really appreciate all that he's done, and hoping that his words of wisdom that he shares can help prevent other doctors or other office managers from being in the same position. So yeah, we're not here to scare anyone, but there are real consequences for some of these actions. And if we can help everyone just before that even happens, just prevent some of these mistakes, that's all we want to do.
Absolutely. And if ever you're questioning anything or need help, you can email us at info@withwisdom.com. And if we don't have the answer, we're not afraid to say, I don't know. We will help find you someone who does.
That's right. We're in this together. That's how everyone
Yep.
learns. You got to just have your group and reach out to the experts, and again, get more than one opinion. Reach out to all people.
Yeah.
So if we don't know, we will get you in touch with someone that does know the answer.
Mm-hmm. Yeah. I think that wraps us up for today, unless you have anything else to add.
That is it. Thank you guys so
All
much for
right.
listening.
Yep. See you next time.
Bye.